This is Dr. Daniel Paul, orthopedic surgeon with Easy Orthopedics, and today we're going to talk about 5 possible reasons that you might have elbow pain. If you like this video, we put out new content weekly, so please like and subscribe. So basically, elbow pain. So we'll go through the reasons, starting from most common, usually to least common, plus or minus. So one of the most common reasons for elbow pain is something called tennis elbow. If you have pain right on the outside of your elbow and it hurts when you lift your wrist backwards, you might have tennis elbow or elbow pain. You don't have to play tennis to get it. It's just kind of from repetitive overuse of extending your wrist, and it'll hurt right to touch on that outside of the elbow. So if you do have pain right in that spot, one of the reasons that could be tennis elbow pain. Ways to get rid of it: some people wear a counterforce strap, or you can do, sometimes you'll get an injection right into that area, or just some exercises. It's a lingering injury, it can be really annoying, take a long time and go away. All right, another reason for elbow pain. So if your elbow pain is not on the outside of your elbow, but on the inside of your elbow, right at this little bump here, called the medial epicondyle, you might have something called golfer's elbow, which instead of coming from wrist extension overuse, it's wrist flexion overuse. So again, don't need to play golf to get it. People of all sorts get it. Anytime you're kind of gripping wrong or flexing, you might get it. And the treatments are sort of the same sort of thing. Physical therapy, you can try an injection there. Rarely surgery will be done for golfer's elbow, more commonly for tennis elbow. But those are 2 major causes which comprise most elbow pain. All right, so keep moving around. So if we go towards the back of the elbow, if you have pain right at the tip of the elbow here, you might have something called olecranon bursitis, meaning that the olecranon is the tip of the elbow, and around that is a fluid-filled sac that decreases friction. Usually you don't even know it's there, but sometimes it can get inflamed and it becomes puffy and it hurts to kind of push your elbow on that. It's also called student's elbow from people that rest their elbows too much, and that's something called olecranon bursitis. A lot of times it'll go away on its own with anti-inflammatories. Rarely you may need to get it surgically removed. So that covers most of that. Another type of elbow pain that you can have is on the front of your elbow. So if you hurt right here, you can kind of feel a tendon there. That's your biceps tendon. Sometimes people have biceps tendonitis, or sometimes they'll tear it. If it's torn, that's something that needs to be repaired right away. You can have biceps tears up in the shoulder that you can leave alone for a while, but if they're in the elbow, you really need to repair it. But sometimes that tendon is just inflamed too. So that's one cause of elbow pain. So I think that brings us to 4. And then the 5th reason for elbow pain is elbow arthritis. That'll sort of hurt when you fully extend or fully flex your elbow at first, and then if it gets really bad, it'll hurt through the whole entire arc of motion. Not a super common diagnosis. The elbow is not a weight-bearing joint, but you can see it. For treatment for elbow arthritis, there's really not a whole lot you can do. You can inject it. Elbow replacements really aren't that great unless you're an old person with rheumatoid arthritis or something like that. But you can't lift more than 5 pounds with an elbow replacement, so it's not a super viable option for most people. There's other causes of elbow pain. You can have ligament disruptions, or if you're a thrower or pitcher, there's some other reasons. But those 5 causes are like some of the most common. So you have tennis elbow on the outside, golfer's elbow on the inside, olecranon bursitis on the back, biceps tendonitis on the front, then elbow arthritis, which is kind of in the middle. So I hope I was able to answer some of your questions about elbow pain and give you 5 good reasons for it. If you have any questions I didn't answer, feel free to leave them in the comments below, and I'll do my best to respond, but I can't give you medical advice over YouTube. And again, if you like this video, we put out new content weekly, so please like and subscribe, and thanks for watching.